That stigma of fear and that stigma of labeling people in our communities, in our families, and sometimes even in the doctor's offices. This is what stops people from getting tested. It makes them reticent, scared, and fearful that other people will hear about it and they'll be labeled, and so they don't get tested. And getting tested is bad.
This stigma is real.
It is real, absolutely. The fear of being tested, and so choosing not to be tested, is the number one barrier to all of this. And that real world consequence is a problem. We have a lot of people here. For one thing, we're a global destination.
Yeah,
For
absolutely.
lots of people. Something over 70 million people that come here to visit who don't live here. Our base population, we have huge gaps in a lot of important things, and that's part of that perfect storm. So you have stigma, now you have gaps in the medical system, gaps and deficiencies. And you would know these, and a lot of our listeners, I'm sure, have maybe suffered this with health insurance, coverage gaps, just hundreds of thousands of people now trapped in that gap. Critically, we have other systemic challenges that are in our education within our communities and in the public. And I don't necessarily mean schools. We are not giving young people a comprehensive, medically accurate information they need
Absolutely.
to protect themselves and to make decisions about these important medical issues.
Now, you talked a little bit about it, but I want to go back to Central Florida being that hotspot and the why. But specifically, we're seeing higher rates. Talk a little bit more about that. And I know, like you said, everyone comes to visit Florida, but talk a little bit more about the high rates.